Okay, so thanks everybody for coming back. My name's Davie Morrison. I'm the Participation and Equalities Manager within NHS 24. And what I'd just like, first of all, in terms of the first tile, is maybe just draw your attention to the 111 service, because that will feature as I discuss the approach. The Estates Programme has looked at how our estate is fit for our purpose. And one of the things that in terms of 111, that's was traditionally the out of hours service when your GP surgery was closed and you were unable to wait until it opened or it was an emergency. Sorry, unless it was an emergency, in which case you went to accident emergency. But even that has changed, partly because of the pandemic, and you'll maybe see the adverts that are going to be running over the course of June and July, where rather than people making their way directly to the accident and emergency, unless it is a real emergency in which they need to go, then there is now the direction that they should call 111, because often there's better care pathways which are available for people, and not everybody actually needs to go to accident and emergency. So it's about finding the right care at the right time. So we are already seeing an increase in the number of people who are contacting our service through being unwell, through COVID and the pandemic, and now the changes to the accident emergency. And that's had an impact on the way in which our buildings meet our needs, and that's going to be the focus of my discussion today. Now, Miriam's going to be changing tiles, so if Miriam could do that. And again, Miriam covered this, but I think for me, one of the key things is that the Fair of Scotland Duty places a legal responsibility on particular public bodies, and it's worth checking if your body is one of those that's covered within the particular public bodies in Scotland, and NHS 24 as a health board is. And I'm also aware that there'll be a lot of equality leads on here from across Scotland and different organisations, and this is very much about mainstreaming. What steps did we take to try and mainstream the Fair of Scotland Duty into our business case? And I will be referring to a business case which was published in 2019 on our board papers. And at the end of the presentation, there is a link to the board paper so that you can look at it if you're interested. And the tiles will be getting shared. Now, interestingly, some of the things that Miriam was talking about, in terms of our workforce, 82% of our staff are women. And if you think of the socioeconomic impact that in Scotland that can have on women, so our 82% of our staff are women. So that's quite a significant number when you look at our overall number of staff. And more recently, because there's been a recruitment drive to address the pandemic and to prepare for the accident and emergency and the changes in the way in which people should be attending there. That's called the redesign of urgent care. We have been increasing the number of staff who've been working with us, and through that we've seen an increase in younger people coming to work for us, which we see as a positive as well. And I should also say that the staff within NHS 24 are a skilled workforce within, particularly in the frontline services, where there's clearly there's a high level of practice that needs to be put in place to make sure that people get the right care at the right time, and appropriate supervision for all staff to make sure that that's possible. So Miriam, if you could maybe move on to the next slide. So what I'm going to talk about today is the establishment of an Estates Programme Board. And I should say from the outset, and just clarifying what I've already spoke about the redesign of urgent care and how that's placed extra responsibilities on 111 service and NHS 24 overall, the pandemic, and the need for physical distancing and infection control measures. One of the things that I'm going to refer to in the paper in 2019 was about a request for us to move out of offices which came under the ownership of another health board. But actually, if you look at what's happened since then, there's been a tremendous shift in the way in which our estate has been handled and managed. And even yesterday, there was a publication by the Scottish Government on the consultation for health staff to work from home, to have the options to work from home, to have the options of work within the office, and an option to have a blended approach of home working and office working. So, and I think that's probably something which, given that a lot of us have the experience of working from home for the last 15, 16 months and probably going to continue on for the next few months, it is perhaps something that's worthy of consideration. If your own organisations do start to look at their estate, then perhaps this is an approach that you can take when you begin to look at what are the decisions that are going to be made in a strategic level. So if you perhaps, Miriam, if you'd be obliged, and I'd be obliged if you could move on. Thank you. So this was a request in 2019 that NHS 24 received to vacate office premises, and we were located within another national board, and due to the expansion of elective surgery, there was a need for the office space which was occupied by NHS 24. And whilst this came as a surprise to us, we did have sufficient time to plan. And what we did was there was an estates programme board established. And looking at the internal stakeholders who were involved in that, this was a very positive experience, because we had people from service delivery, human resources, technology, facilities, all of the directorates were represented, equalities function was represented through attendance by myself, staff side engagement, and looking at the IT security governance arrangements as well. So it ended up there was about 20 of us attended a workshop, and we were all split into groups, and what we were asked to do was to look at what are the different things that each of our functions should build into a business case. So that this wasn't about here's a business case that's on the shelf and let's just make sure that we work through it. It was actually a great opportunity for us all to work together to identify what was important to our own functions, to make sure that that was built in. And it's an approach which I would absolutely recommend, because hopefully what we'll have is I'll have a time at the end just to show how that we have expanded our approach and maintained and continued the approach that we took. So Miriam, if you would oblige and move on to the next slide, please. Clearly, one of the things that I wanted to include within the business case was the equality impact assessment. And it was important that the Fairer Scotland duty was included within that. And so this was very much about having the discussions within the workshop. We were all split into different groups, and we were asked to prioritise what our key areas of inclusion should be. And so that gave me the opportunity to start to introduce into the conversations the need that for the Fairer Scotland to consider the socio-economic impact. Now, for this business case, this was very much focused on the west of Scotland. But what we were able to show was and start to build up was, you know, where as public servants or public service, where could we seriously have an impact on the socioeconomic impact of local communities? What could we do as a public service to enhance the lives of people within the west of Scotland? And that was very much focused on a realisation that as a board within the NHS and the number of staff who would work for us and with us, that if we chose the appropriate locations, then this would have a bigger impact on people who were identified as, through the Scottish Index of Multiple Deprivation, as experiencing poverty or socioeconomic, a higher level of socioeconomic impact than perhaps from other affluent areas. So one of the things that we did was we agreed that we would build in to the business case the Fairer Scotland duty. And to that, we applied a weighting criteria. So perhaps if you could move on, Miriam, to the next tile, please. Within business cases, there are best values. So you've got your financial benefits and your financial criteria. But also within that, we were determined to build a non-financial benefits criteria. And what we had to look at was, well, what would these be? And I will be coming on to that in a moment. But from a socioeconomic inequality perspective, one of the things we wanted to look at was, what are the employment opportunities in the areas in which we're going to identify as potentially suitable to move to? What are the opportunities for diverse communities? Bearing in mind that as a national board, NHS 24 has a responsibility to make sure that, as far as it can do, that the composition of its staff replicates the composition of the population it serves, and there is an underrepresentation from minority ethnic communities within the employment at NHS 24, and we had set an equality outcome. So it was entirely reasonable for us to make sure that when we were looking at employment opportunities that extended to work that we had already identified that needed done and wanted to tackle. And also NHS 24 has a 12% of the NHS 24 staff identify as being disabled. And it was really important that any move needed to take account of their needs to make sure that they could continue to work with us. So there was definitely the opportunities to look at what are the employment opportunities in the areas, what employment opportunities for diverse communities, and included within that is the retention of our staff. In terms of the businesses supported within local communities, one of the things that we wanted to look at was, if we located to an area of where there was socioeconomic deprivation, as evidenced through the Scottish Index of Multiple Deprivation, then we could look to support local businesses by our staff travelling to and from our site, the staff making their way to local shops to purchase items for lunch or whatever, and the impact that that has on the local economy, where staff can get recruited to local businesses. There's bus services and train services can be see an uplift in the number of people who are using them. Garages can be supported. So it was very much about just, although we know we're relocating to an area, how can we benefit that area, not just in terms of the employment, but also the local businesses support, and then therefore the local impact that that will have onto the community itself. So again, if you could move on, Miriam, that would be helpful. Now, one of the things that we had to do was we had to look at the agreed weighting, and please don't be disappointed when you see that the weighting allocated to socioeconomic inequality is 10, because we hadn't done anything like this before. Clearly, as a 111 service, we operate 24/7, so a clear need in terms of our non-financial benefits criteria was to look at the weighting for an operational capacity which allowed 24/7. So that we allocated 25 to that. Provide person-centred care. What we were thinking about here was that we wanted to, we already co-locate with the Scottish Ambulance Service in some of our offices. So what was the potential for us to identify office premises where we could co-locate with other health boards or with the local authority, and what impact would that have in terms of person-centred care and the provision of that? Clearly, we wanted to provide safe and effective care, and one of the key things that we had to achieve here was we had to make sure that we retained our workforce and had the potential to recruit new members of staff from a pool that was within the area and suitable for transport links as well. And then safe, effective, person-centred workforce. I think that I've already kind of explained that in terms of some of the previous requirements, because we wanted to make sure that whichever premises we chose, staff would be able to get to there, they would feel safe, and they would be able to maintain a workforce which actually, as it turns out, feel that the premises is an excellent choice. And then looking at socioeconomic and equality impact. So starting to build this in, this was something which we were now building into our business case. We were going to build it into our impact assessment. And for the first time, this was us starting to able to say, right, okay, the socioeconomic impact does have a weighting, and how can that influence the business case? So if we could maybe move on, Miriam, please. As I mentioned earlier, the impact that the pandemic has had in terms of the physical distance and additional services added has resulted in there's a need for additional office premises. And the office premises that we chose through the Clyde relocation was actually to relocate to an office premises in Hillington, which had a similar index score when you looked at the Scottish Index of Multiple Deprivation, and afforded opportunities within the local community and support local businesses whilst ensuring that our staff felt comfortable there. And as it turns out, it's a magnificent building, and it's one where the staff have settled in and well. But through the business case, we now have a raised awareness within the executive management team and the board, because each of the programme board papers that were taken to the executive management team referred to the socioeconomic impact, and also to the board. They were contained within the board. And when we're looking at our strategic decisions, I always feel that it's the executive management team. If the executive management team is making a decision which then goes on to board, from our perspective, that's a strategic decision. So this is how we're trying to build in the Fairer Scotland duty. And certainly in the past, I have been along to the executive management team and to the board to provide training on health inequalities and general equalities, and referencing the Fairer Scotland duty. But this was live. This was actually them being part of it, because they were attending the meetings, they were discussing it, they were seeing it within the papers, and they were signing off on it. And one of the best benefits now is the Fairer Scotland duty is now built into the business case. It was signed off by 2 cabinet secretaries, and as a consequence of the pandemic, we are continually having to reassess the need for the capacity of our premises and the location of our premises. And one of the things that we are doing now is that we're reassessing all of our premises, the suitability, identifying if there's a need for increased capacity, how we're matching that. And within each of these business cases, there's the non-financial weighting criteria, looking at the socioeconomic impact of the decision. So I'm very comfortable now that we've arrived at that stage where within our estates programme board, there is that is embedded, and I think that's really important. But in addition to that, we're also seeing a greater awareness amongst the executive management team and the board of how the Fairer Scotland duty can have an impact on our business cases, how it does apply to non-financial weighting criteria. And more importantly, I think across the colleagues, and when we look at mainstreaming, how do we mainstream the work that we do, I'm very much more confident now that all of the discussions that we're having is very much about what's important for delivery, what's important for staff, what's important for how we make sure that we run as an organisation effectively, but also how can we influence the impact in terms of socioeconomic impact within local communities, and how can we improve opportunities locally. And we have actually extended this now to cities, so we're not just looking at locations now in the west of Scotland. We have been carrying out work across the Estates Programme Board, which is also looking at suitability in terms of cities and staffing, availability of staff, and built within each of these examples is the importance of considering the socioeconomic impact. So that's just one approach and how we have tried to embed, and I think successfully embedded the conversations and the discussions and the decisions on the socioeconomic impact within our business cases. And just in terms of the final slide, please, Miriam. My contact details are there, but more importantly, the link to the board paper, which sets out in much greater detail the decisions and the approach that we took, is contained within there. It's on the NHS 24 website. I think it goes back to December 2019, but it's the link to the board paper is there if MDs want any more information. And thanks for taking the time to listen to me.